We're super excited to be here today with Dr. Michelle McMacken. Now, Dr. McMacken is an assistant professor of medicine at the NYU School of Medicine, and she's an honors graduate of Yale University, which means she's extremely smart, and Columbia University College of Physicians and Surgeons. Dr. McMacken practices internal medicine at the Adult Primary Care Center in the New York City Health and Hospitals at Bellevue, where she also directs the hospital's weight management program and plant-based lifestyle medicine program, which is due to launch this coming January, which we're going to learn a lot more about today. Through a 2014 NYU grant, Dr. McMacken studied evidence-based nutrition and developed a nutrition curriculum for her internal medicine faculty colleagues. She's also received the Teacher of the Year award 3 times for her work with physician trainees and has presented on nutrition at several large academic national conferences. She's also been featured in several documentary films, including What the Health, Code Blue, Diet Fiction, which is coming out in January, and From the Ground Up, and popular nutrition websites, including Forks Over Knives and Mind Body Green, as well as a whole collection of podcasts, including the Rich Roll podcast and Plant Proof. In a nutshell, Dr. McMacken is a total rock star. She's all over the place. And if you've never heard from her, be prepared to be amazed today. So thank you so much for being here with us today, Dr. McMacken.
Thank you so much. And I'm going to steal your short version of the bio right there.
I love it.
Thank you.
Yeah, your bio was so long. I was like, we got to cut this down. So let's start at the top. You recently published a paper on plant-based diets for the prevention and the treatment of type 2 diabetes. Can you give us a little insight here into some of the studies that show just how effective a plant-based diet can be for the reversal of metabolic conditions and the treatment of metabolic conditions that are related to diabetes in addition to diabetes itself?
Yeah, definitely. So I think the literature, it's when we were writing this paper that you referred to, which was published in 2017, we were absolutely astounded by how much literature there was out there. And we, for that reason, have literally over 150 references, and we had to cut some short. So I think the big studies to look at, I like to think of them in 3 different sections. There's prevention, there's treatment, and then, as you alluded, there are studies showing improvement in or prevention of common complications of diabetes. So in terms of the world of prevention, we have a few big data sets that are really illustrative of how powerful a plant-based diet can be. So the first is really the Adventist Health cohorts. And what those studies show, this is a group of individuals, obviously, this is a cohort of people who are overall health conscious, but within that group, there are people who follow omnivorous diets, people who are semi-vegetarian, and people who are vegetarian or vegan. And so it's a really cool group to study because when you look at people who are overall health conscious but have different eating patterns, it tends to isolate out a little bit more the effective eating pattern. So what we see in the Adventist groups that have been studied both at one point in time and looking forward in time is that consistently, independent of body weight, which is an important thing to look at, independent of other risk factors for diabetes as well, people who adopt a fully plant-based diet tend to have at least half the risk of having type 2 diabetes than their omnivorous counterparts. Just think about that. Half the risk. And that's just looking at one point in time. But again, that's independent of how much excess body weight a person has. And that's a really important thing because we know that carrying excess body weight does tend to increase the risk of type 2 diabetes for most people. Looking forward in time in that same group, we see these dramatic differences in terms of risk of type 2 diabetes. So I think something like 41,000 people followed for 2 years. People eating a plant-based diet had a 62% lower risk of developing type 2 diabetes compared to omnivores. And that's, again, independent of body weight and other risk factors. So this is extraordinarily powerful. And most recently, one of my favorite studies to be published to date is something called the Rotterdam study. And Rotterdam is in the Netherlands, and there's a group of about 8,000 people that were looked at for just how plant-based their diet was. And these were actually all omnivores, but they were ranked according to how many plants they ate within their diet and how few animal products they ate within their diet. And every time they got a 10-unit higher score on that index, they lowered their insulin resistance, they lowered their risk of pre-diabetes, and they lowered their risk of type 2 diabetes. And again, the insulin resistance and type 2 diabetes was independent of body weight. And this becomes very relevant when we talk, which I hope we will talk later on, about other eating patterns that may confer some benefit because they're associated with weight loss, at least up front. The really amazing thing about plant-based diets is there's a lot of data showing reduction in risk independent of weight loss. So it's something just about the foods themselves.
Yeah, actually, I think that's a really good point, because if you go all the way backwards in time and you look at studies from the 1930s with Dr. Rabinowitz and Dr. Walter Kempner in the 50s, and then you get to, there's a lot of criticism about those studies because, they were able to get people to reduce their insulin dependence. They were able to get people to improve their blood glucose control, but those individuals also lost a significant amount of weight. Mm-hmm. So at that time, people were saying, oh, well, it could be the weight loss or it could be the food. We don't know which one it is. Then in the 70s, Dr. Anderson came through and he designed one of the first studies to actually tease out that, even without weight loss, you can still get dramatic improvements in diabetes health, which is exactly what you're saying as well.
Exactly. And actually that Anderson paper is one of my favorite papers to look at to show that exact point. So you have people, you have men who I think we're actually all at what we typically call a healthy body mass index to start with, or they were lean. But he had them go on a plant-based high fiber diet that was low in fat. And if they so much as lost any weight at all, they were asked to eat more food. And yet half of them came off of insulin. And so you don't really see that with other eating patterns that are claiming to, quote unquote, reverse diabetes. You don't see people eating more carbohydrates, keeping the same body weight, and yet having their insulin requirements or their diabetes medication requirements go down. So it's pretty phenomenal. And other treatment, other randomized controlled trials of plant-based diets for diabetes have consistently shown that they actually outperform their conventional counterparts. So I know there's a couple through Dr. Barnard and his group that have looked at plant-based diets for people with type 2 diabetes compared to sort of a more conventional American Diabetes Association style diet, and that outperformed the ADA diet in terms of not just glycemic control, blood sugar control, but also in terms of how many people came off of medications, how much their blood cholesterol lowered, how much weight they lost. And then there was actually another study done in Korea, where there was a brown rice-based, plant-based diet for the treatment of people with type 2 diabetes compared to a conventional Korean Diabetes Association style diet, and same findings. So we have a lot of evidence that plant-based diets work for prevention and treatment of type 2 diabetes, and that's partly why every major diabetes organization actually authorizes and supports the use of a plant-based diet for type 2 diabetes. And in fact, the American Association of Clinical Endocrinologists actually recommends it as the preferred eating pattern for people with type 2 diabetes. So this is a very evidence-based and actually now mainstream approach. This is something that we know to be effective. There's a lot of evidence, and it's well supported by mainstream organizations.
Okay, this is great. So your answer takes us perfectly into the next question. You hinted at other dietary patterns that help people lose weight. So you're talking about a plant-based diet here, high fiber, which is very different than a ketogenic and low carbohydrate dietary pattern that is talked about most often in the world of diabetes health. So does that program, does a ketogenic, a low carbohydrate approach, does that address the root cause of type 2 diabetes?
So I'm going to answer that by discussing first what are the root causes of type 2 diabetes, because I think it's really confusing. It's confusing for my patients. It's confusing for health professionals. And I think that it's not a straightforward answer, but clearly one of the big root causes of type 2 diabetes has to do, and probably the major cause has to do with the buildup of certain types of fats inside of our skeletal muscle cells, which are the muscles that you have under your skin, on your arms and legs and so forth, and also inside the liver. And what we're talking about right now is type 2 diabetes, of course. So where the primary problem has to do with insulin not working well. So when certain types of fats build up in the liver and in the muscle, the function of insulin is impaired. So the insulin hormone just does not work as well. And then when that happens, you tend to see high blood sugar for a few different reasons. And then eventually that leads to type 2 diabetes. So then the question becomes, why would we build up fat inside of our skeletal muscle cells and inside of our liver? And some of the big reasons for that, number one is just carrying excess body weight. So the more weight you gain, there tends to be, especially in people who have ethnic predilection or have genetic predilection to get type 2 diabetes, there tends to be a spillover effect where some of that fat tends to also get stored in the skeletal muscle and liver. The second is just eating too many calories. If you eat too many calories, like way too many calories, day in and day out, I mean, if you have 1 or 2 bad days, not a big deal, but day in and day out, eating too many calories can tend to also lead to the spillover effect. I think the third thing is interesting, and it has to do with dietary fat. I think that the data on this, the way I read it, is there is a spillover effect with how much fat you have in your diet, but it's really, really specific for saturated fats. So although we all probably reach a threshold beyond which all types of fats would do this. But what really is the issue for most people is the amount of saturated fat in the diet to start with. So saturated fats, as most people may know, are primarily found in animal foods, but are found to some degree in all types of fats that are out there, even avocados or vegetable oils. But primarily they're found in animal foods. And what happens when we eat a diet that's rich in saturated fats is that it does tend to promote that buildup of an unhealthy type of fat inside the liver and muscle. In fact, there was this amazing study. You guys probably saw it. It was published a couple of months ago where they actually overfed. They divided healthy people into 3 groups, and each group was forced to eat 1,000 extra calories a day. Okay, that's actually quite a bit of food to eat 1,000 extra calories a day that you don't need. One group ate 1,000 extra calories in pure saturated fat. I don't know exactly. I can't remember if it was lard or what they actually fed them, but it was basically saturated fat. The next group ate unsaturated fats. So that, as you might find in vegetable oils or nuts and seeds, avocados. And then the third group ate pure fructose in those 1,000 extra calories. Okay, so basically pure sugar, okay, without any fiber attached to it, as you would find, say, in fruit. And every time I bring up this study in a lecture to doctors or to anyone, and I ask them, which group do you think had the most fat deposited in their liver? The group eating.
Let me guess. Yeah. Every single one is going to say number 3, the fructose group, right?
Correct. I mean, literally no one ever does not guess that it's sugar. When in fact, actually the group eating pure saturated fat had twice as much fat buildup in their liver as the group eating pure sugar. So all this to say, nobody is advocating that we eat pure sugar, and nobody is advocating, I'm also not advocating that we eat pure saturated fat. I mean, there is a third way. There is a better way. But the point is that saturated fats in particular, are very, very potent at building up fat in these organs that then leads to insulin resistance. And then the other reasons for the root cause of type 2 diabetes have to do with inflammation, have to do with poor function of the mitochondria, which are the fat burning and sort of powerhouses in our cells, and stress inside of our cells. And so all of that is closely related to our lifestyle and closely related to the foods that we choose to eat. So going back to your question, Robbie, do low carb, high fat or / ketogenic diets address the root cause of type 2 diabetes? So I'm going to say yes and no. The yes part has to do with weight loss. And so if you lose weight on any eating pattern or any any problem that you have. I mean, there's lots of unhealthy ways to lose weight. Remember, there's healthy ways, there's unhealthy ways. You could get very sick for another reason and lose some weight. However you do it, if you lose some weight, you're going to get less insulin resistance. So in some ways, that part does address it. But the rest of the things that are going on when you're choosing a low carb, high fat diet, what most people end up doing is choosing animal sources of protein and animal sources of fat. In other words, saturated fats. And so those things actually, the evidence shows, tend to drive insulin resistance. So you're really not getting the most bang for your weight loss buck, first of all. And second of all, perhaps the most important point in my mind is when we talk about reversing or putting type 2 diabetes into remission, you really have to think about restoring the ability to eat healthful, carbohydrate-rich foods without having your blood sugar go very high. No low-carb, high-fat diet has ever been shown to do that, period. You cannot say that you are improving someone's type 2 diabetes if they are not able to tolerate carbohydrates, if you have not shown that they're able to eat a piece of fruit without having their sugar go high. If that makes sense.
So let me stop you there for a second, because one of the counter arguments that we see all the time from the ketogenic community is they say, why would you ever want to eat anything carbohydrate rich?
Right.
End of story. A fruit, a potato, a bowl of quinoa, some rice, you name it, right? Type 2 diabetes is a condition of carbohydrate toxicity. Those are the words that they use, right? So what you're saying is, okay, I'm going to teach you how to eat such that your tolerance for carbohydrate goes up over the course of time, versus them saying, no, you just don't put carbohydrate into your mouth at all, period, end of story. Not today, not tomorrow, not 20 years in the future.
Yeah. Yeah. So my response, I hear that response all the time too. And I think the answer to that one is actually fairly straightforward. And that is this. We have a huge amount of evidence showing that low carbohydrate diets of all kinds, whether they're ketogenic style low carb diets or a little bit or non-ketogenic low carb diets, increase the risk of cancer, increase cardiovascular risks, and increase the risk of dying of anything. So we also have incredible, compelling, convincing data that eating these healthy carbohydrate-rich foods like fruits, like starchy vegetables, and especially whole grains and beans, that these prolong life. They increase vitality. They decrease the risk of chronic disease. We need the nutrients in those foods. They promote a healthy gut microbiome. They're anti-inflammatory. People who eat this way have lower cancer rates. People who eat this way have lower heart disease and stroke rates. It's absolutely, you're really taking a huge risk if you do not have those foods in your diet. We've never had a population on Earth that has thrived long-term on a diet that excludes those foods, period.
Okay, so you just said the key word here, which is long-term. Because I think what happens to a lot of people is that they adopt a ketogenic diet and they see tremendous improvements over the first, let's call it 6 months, 9 months, a year, right? They lose weight, just like you alluded to. They lose weight, they drop their LDL cholesterol in some situations. Their blood pressure goes down, their A1C goes down, their blood glucose variability goes down, their energy levels go up, and they feel like $1 million bucks, and they say, look, I found a solution, right? Yeah. But we like to tell people that short-term results are different than long-term results because it depends on what you're putting into your body over the course of time. So my question to you is, what happens to an individual who eats a ketogenic diet over the course of time? Do we have sufficient scientific evidence to answer that question?
No. We have evidence that low carb diets in general, as I just was referring to, have a lot of deleterious consequences long term. And for specifically ketogenic style diets, I see a lot of proponents talking about small changes in blood markers, triglycerides, and other things, which what we're talking about now is we're talking about what we call hard outcomes. In medicine, a hard outcome is like, did you have a higher risk of a heart attack? Did you have a higher risk of cancer? Things that are clinical events. We don't have that data whatsoever specifically for ketogenic diets. What we do have are a couple of big meta-analyses, which are basically, it's a word for putting a lot of studies together, looking at outcomes at about 2 years, 1 or 2 years. for people following these very low carb, high fat diets. And what they show is, number one, when it comes to weight loss, people aren't even losing that much weight. At 1 to 2 years, it's like 2 pounds different than the comparator diets. Okay, so yes, people tend to lose weight up front, and there's some reasons for that, which we can get into. But long term, we don't have evidence that the weight loss persists. Number two, we don't have evidence that the blood sugar gets that much better at long term, at 1 to 2 years. And then we have no data whatsoever on prevention or reduction of risk in typical complications of diabetes, like heart disease, kidney disease, diabetic neuropathy, things that we have very strong evidence for a plant-based diet and reducing the risk.
Okay, so let's go into a little bit more detail on how a plant-based diet actually helps to treat insulin resistance. So you touched on it a little bit, but if you can give us some more details, that'd be great.
Yeah, sure. So I think it's really a synergy of a lot of different things. So the first thing I would say is a lot of it has to do with fiber in the diet. And of course, fiber is found only in plant foods, and it's richest in plant foods and their less processed forms. So if you're eating a diet that is filled with fruits, vegetables, whole grains, beans, you're going to get tons of fiber in your diet. And that's a great thing for a few reasons. Number one, the more fiber in your diet, typically the less calorie dense your diet is. And that's a fantastic thing if you are looking at long-term healthy body weight, maintenance or achievement of a healthy body weight. Number two, if you're looking for improving or preventing diabetes. So just the fact that you're sort of filling your body with fiber makes your diet less filled with calories, and that's a fantastic thing that helps improve diabetes. Number two, the fiber in plant foods is the number one food that our gut bacteria like to metabolize. That's the number one food to build a healthy gut microbiome. And so why is that important? Well, we know that our gut bacteria are very, very closely related to our overall metabolism, and of course to a lot of other health benefits as well, like cancer reduction. But when it comes to type 2 diabetes, what our gut bacteria do for us is they eat the fiber that we're eating in our plant foods, and they metabolize that fiber into these unbelievably amazing molecules called short-chain fatty acids. Okay, and one of them is called butyrate. So what these short-chain fatty acids do is they actually help your insulin function better. They also help those mitochondria, those sort of powerhouses in your cell, they help them burn more fat so that you kind of get rid of some of the fat inside those cells where it's not supposed to be. And they're very anti-inflammatory. And all of this works together to address the root cause of insulin resistance. And, fiber also slows down how much your blood sugar spikes after you eat something. So that's a classic example of why eating a whole piece of fruit and taking the time to chew it, you have a better blood glucose response than if you just drink pure juice, for example, because it doesn't have the fiber. Other things that a plant-based diet does to promote insulin sensitivity is that it's filled with antioxidants. And so antioxidants and other polyphenols in a plant-based diet are anti-inflammatory, and they help decrease the stress inside of our cells, which then helps insulin function better. Other things that we see with a plant-based diet is that it basically does not have some of the concerning elements of the animal foods and highly processed foods. So particularly, it does not have iron in its heme form. And this is a really big one because lots of studies that have looked at different nutrients and their relationship with diabetes have shown that heme iron from animal sources, is at the top of the list when it comes to increasing insulin resistance. And lots of reasons for that, but it's pretty clear across all studies. So you can get plenty of iron from plant foods, the non-heme form, and when you do that, that actually lowers your risk of type 2 diabetes. Other things good things that you're not getting when you're following a plant-based diet is you're getting fewer of molecules called advanced glycation end products. So I'm throwing out a lot of big words, but these are all well-established reasons why a plant-based diet is beneficial, relative to other eating strategies. You're not getting as many nitrosamines, which are compounds that when you have nitrate preservatives mixing with particularly the amino acid profile that you would see in animal protein sources, these also tend to promote insulin resistance. And finally, at the risk of giving you a really, really long answer, something called a molecule called TMAO. And you guys may have covered this in I know you guys do tons of webinars. TMAO is a molecule that is formed by our gut bacteria and our liver when we eat foods that are rich in choline and L-carnitine, so particularly eggs and red meat. And so when we make this molecule, TMAO also, in addition to promoting heart disease, it tends to promote insulin resistance. So all of these reasons together, you have less inflammation, you have more fiber, you have better gut bacterial patterns, and you tend to have a better chance at achieving a healthier body weight. All that works together to promote decreases in risk of diabetes and improvement in type 2 diabetes on a plant-based diet.
Could you go into a little bit of detail here about these advanced glycation end products? Because I think they're fascinating. Yeah. And it's kind of it can be a vague concept for a lot of people. Do advanced glycation end products, are they found in food, or does your body make them in response to what you're eating? Can you maybe tell us a little bit more about that?
Yeah. Actually, and I can also, I don't know if you're going to have show notes. I can send a great review article that I really liked on advanced glycation end products. But yeah, they're found in foods, and many of them are preformed, and they tend to be much higher in highly processed, ultra processed foods, as well as in animal foods. And they tend to be inflammatory. And that's really one of the main issues with these advanced glycation end products. Anything that tends to promote inflammation tends to increase the stress inside of our cells and tends to promote that buildup of those unhealthy fats in the muscle and liver. So that's kind of how I think about it simplistically. I'm certainly no expert, but that's how I think about it.
Okay, so you have given us a lot of amazing information in this short interview about why a plant-based diet is so effective and so helpful for overall health, for diabetes, for insulin sensitivity, but yet it's still not being talked about. The doctors are still prescribing a low carbohydrate or ketogenic approach. And you're a physician, you're working with patients, you're in this game. Can you give us some insight on why you think that's the case?
Yeah, I think that we as physicians are subject to a lot of the same confusion that people who are not in the medical community are subject to, because I don't have to belabor the point that we're not taught a lot about nutrition and in our training. But I think that we see things in the media. We see people, anyone who adopts a low carb diet, as you guys have alluded, is typically going to see their blood sugar drop at the beginning. Not everyone, but many people at the beginning. And sometimes they actually feel better. And part of that is actually because they're just eating less of the unhealthy carbohydrate rich foods. That's a key thing that I see is like people come to me and they're like, oh, I stopped eating candy bars and white bread and, bagels and donuts, and I feel better. And of course you're going to feel better. And guess what? I'm going to recommend that also. That's consistent with the healthy plant-based diet, is avoiding those foods. So but I think that it's confusing for doctors and for patients, because when you reduce your carbohydrate intake, whatever the source, your sugar may go down initially. And therefore people interpret that as being the end all and be all of controlling someone's diabetes or improving someone's diabetes, when in reality, you are in many cases simply treating the symptom. And as we've gone over, you're not addressing the root cause, and you may even be increasing the person's risk long-term, not just for worsening diabetes, but for complications of diabetes. So one of the things that I'm literally on a crusade to do is to raise awareness about the root causes of diabetes. And I think that one of the best ways to do it is to show not just scientific data, of which we have a lot, but also to show patient examples and talk about real live people who have, put their diabetes into remission by eating more healthy carbohydrates, eating a healthy plant-based diet. And so when I give talks to doctors and medical students and to the public, those are some of my strategies that I use.
I love this. This is, it's funny because in some ways it's very simple. And in some ways it can be overly complex, depending on how much information you're looking for and how minute and granular you really want to get. One of the questions that we get a lot that I think you're very well suited to be able to answer is, somebody starts adopting a whole food plant-based diet and they see tremendous, improvements in insulin resistance. Their A1C starts to drop. Maybe their cardiovascular health starts to improve. Maybe their fatty liver starts to go down. Their chronic kidney disease starts to improve significantly. What is the period of time that these effects take place over? Is it 1 week? Is it a month? Do they have to wait a year? Give us some insight there.
I've never seen anyone have to wait a year, and I've rarely seen people have to wait even a month. I think it's definitely variable. I have had people who change their diet and to a plant-based diet, and within 36 hours are seeing improvements. And actually, that can be sometimes scary as a physician, because I've learned the hard way that I actually have to decrease people's medications for diabetes right up front before they change their diet. If they're very motivated to change, because I'm much more afraid of people having dangerous low blood sugar in that period where they're changing their diet. But yes, for some people it's very quick, and for others it takes, may take a few weeks. But I would say I've never seen, in my experience, I've never seen a patient who did not have some improvement by switching to a plant-based diet. And in most cases, it's actually quite dramatic.
Excellent. Now, in the world of diabetes health and really nutrition in general, people talk a lot about calorie counting or controlling their portion sizes. Is that necessary on a plant-based diet as well?
So if you look at I'll tell you first what I see in the data, and then my own personal experience with patients. So in the data, the randomized trials of plant-based diets, low-fat plant-based diets for people with type 2 diabetes, in no study that I'm aware of were people asked to consciously count calories or count carbohydrates or measure portions. They were just told to eat. If you're hungry, you can eat more food. Just choose healthful, whole plant foods as your food of choice. And that worked out great as far as people being able to lower their blood sugar. And as I've said before, outperform conventional diets where they did have to count calories and count carbohydrates for type 2 diabetes. So that's the published data. And in my personal experience, I find that I think that what I see sometimes patients doing is focusing a lot on, if they focus a lot on, for example, nuts and seeds and grain foods, and they're not also eating fruits and vegetables, and they're just not having a balance, that they're not going to see results as quickly. So I do tend to, and you're missing out on nutrients if you're not getting all of the different healthy plant food groups in there. But I never advise people to count, certainly not to count calories, and very rarely to count carbohydrates. I take care of mostly type 2 diabetes patients, so that may be different from some physicians. And as far as portions, I would just say I emphasize balance on the plate, so that you're having ideally your plate should include a lot of veggies, half veggies, some legumes like beans or lentils or chickpeas, and then either a starchy vegetable or a whole grain. And that's like one ideal plate for the day, or spaced out throughout the day, but getting a balance of all the healthy plant foods.
Yeah, I mean, it's pretty amazing to hear a physician say, my patients with type 2 diabetes, I do not have to tell them to limit their carbohydrate-rich foods.
Oh, it's like one of my favorite things in the world to watch my patients who've been told over and over, like, you can't have a sweet potato. And for me to sit down and say, well, if you like sweet potatoes, please eat them. In fact, just enjoy your sweet potatoes. What you put on them or how you cook them matters. But if you like sweet potatoes, go for it. That's great. And you're probably going to get healthier if you eat more of them.
Absolutely. Okay. So you recently received a grant to study and teach evidence-based nutrition to other doctors, so the message of healthy eating can spread farther. Can you tell us a little more about this program?
Yeah. So this was born out of, I'm sort of a reformed internal medicine doc, where like the first 9 or 10 years of my practice, I knew very little about nutrition. And I was, largely a pretty conventional practice where I prescribed pretty much automatically went to medications for most chronic conditions. And then I attended the American College of Lifestyle Medicine conference in 2013. When I didn't even know what that term was. I was like, lifestyle medicine, that sounds like, like having a great lifestyle. And, maybe I'll get to like learn about how I can incorporate beach time, in my job, but I went and had a fantastic, really fantastic experience where I learned about basically the fact that we have the power to prevent about 80% of chronic disease through lifestyle change. And it was completely humbling to realize that I had been practicing in a way that was not actually helping my patients address the root cause of disease. So when I came back to work, I started trying to address lifestyle change and diet and with my patients, but without a lot of training. So I decided to apply for this fellowship where I would actually be able to study evidence-based nutrition for chronic disease prevention and treatment and develop a curriculum to teach my colleagues more about it. And for me, it was really important that it be practical and relevant because I have a very short amount of time that I get to spend with each patient, unfortunately. And so I wanted it to be something that was really usable by my fellow doctors who were in the same boat and something that would reach them at their level of training where it had reached me. So we all are seeing the same conditions day in and day out. We're seeing high blood pressure, high cholesterol, type 2 diabetes, prediabetes, fatty liver, gout, kidney stones, all these things that are related to lifestyle. And yet we think that there's a different diet for every condition, or we don't know what the evidence is, but it's actually really simple. It's like the same thing for every condition. And it happens to be eating more whole grains, fruits, vegetables, beans, some nuts and seeds, and reducing processed foods and eliminating or drastically reducing animal foods. It's just so simple. And then for people who are living with chronic disease, you can actually see dramatic results for people adopting 100% whole food or nearly whole food plant-based diet. So it's been really fun to teach my colleagues this information, and most people in my practice have really taken and run with it. Some of them themselves have gone plant-based because of it, and all of the doctors in training that we work with are getting a similar message from all of us as faculty and the medical students, and so it's really starting to grow, and we have really kind of changed the culture where I work, which is fun.
You're a needle in a haystack because I know that there's a lot of doctors who are involved in lifestyle medicine who start to practice it with their patients and they see tremendous results. But you're taking it one step further and you're saying, okay, how can we turn this into something that's much more, it's much more widely available to more doctors. And it's something that becomes, over the course of time, a de facto opportunity for patients once they enter the door, right? Whether it's a private health clinic or whether it's a hospital.
Yeah.
So my hat's off to you. I know it's a tremendous amount of work. And I feel like what you're putting together is something that's truly innovative that's really going to change a lot of lives.
Thanks a lot. Yeah, it's really satisfying to see when sort of the light bulb goes off and a doctor who never had this training and is suddenly now like just they get it. They're like, oh yeah, that actually makes sense. And then they practice it. All it takes is one patient with a health improvement. Then you're sold.
So true.
You see it yourself in your patients or in your family members or even in yourself. You're sold. Like, you showed me tons of data, but until you see it work in front of your face, you don't fully believe it. And so that's what we're seeing in our practice. So it's really being anchored. It's a lot of fun.
100%. So can you tell our audience how they can also become Michelle McMacken groupies just like us?
So I actually don't have a website. I'm primarily on Instagram and Twitter, and my handle in both places is at VEG_MD. And that's really the main place. And I tend to do, I do a lot of public speaking, and I try to post about that on those sites to make it so people know about it.
And in case, you guys who are listening to this interview, in case you have not gone onto Instagram to follow Dr. McMacken, or you're not aware of, her skills in this category, do it, because she's constantly...
I like that tone.
She's posting phenomenal information, evidence-based science on a daily basis. And it's like these little snippets, which really give you insight into just how much scientific evidence there really is to back every claim that she's made and every claim that any of our speakers make here in this Mastering Diabetes Online Summit. So take the time to do it. It's well worth the adventure, and hopefully you'll be able to follow her as much as and become a groupie just as much as us.
It's a heck of an adventure. You do not want to miss it. Her Instagram stories are legendary. Okay.
Absolutely.
You guys are awesome. Thank you.
Absolutely. Well, thank you for taking the time to be here with us today. I mean, this is just the tip of the iceberg. I mean, we could go in so many different directions here, but just for the sake of brevity here, we'll end with the conversation here. But I know that you put in so much effort to really sort of transforming the lives of your patients, and now also helping other doctors start to create lifestyle medicine, have opportunities to practice lifestyle medicine. So like I was saying earlier, I know it's a ton of work for you to do, but it's worth every ounce of effort. And we totally appreciate every last minute that you're not sleeping to get this job done, because it makes a huge difference to your patients and to doctors all around the world. So thank you so much.
Thank you. And right back at you guys. What you guys are doing is phenomenal, and really appreciate what you're putting out in the world too. So thank you.